budget instead of 2021. I think that Director Booth said that was all that needed to be changed.
February, March.
Motions in 2 seconds.
All right.
All right, we'll start with COVID-19. As far as vaccines go, available, we have the Moderna and the Johnson & Johnson vaccine, also known as the Janssen vaccine. We will be giving our first doses of the Johnson & Johnson this Thursday. And we will be doing a clinic of, I think, 10 individuals for that first clinic. And then we will be still doing our regular Moderna shots in addition to the Johnson & Johnson. Total Moderna vaccines given is 3,164 total so far. That's just for us. That does not include Tallulah Clinic or Walgreens. So for the total for the county is much higher than that, but that's what we vaccinated so far. As far as the testing goes, the OptumServe, which was the free testing site down by the school, has closed permanently. We are looking at getting another vendor out to do that testing because as of right now, we do not have a free option for the send-off tests. So we are still testing for those that are symptomatic for a rapid test, but as far as a mail-off test, Tallulah and the urgent care are the two options right now. And so we will be revisiting with the state, having another vendor come in and provide that service. However, the school is not going to offer their site again. So if we find another vendor, we are, as a county, going to have to decide whether we want to put them. So I would like the board to give that some thought. I don't know, we can obviously do it in the health department parking lot, but it was very convenient having it within walking distance of downtown for the testing. We had discussed earlier Ingles parking lot or, which the library parking lot is not that big and neither is this one, so we don't really know if there is a county lot sort of open that is even big enough to run what OptumServe was running down in front of the school, or in front of the gym. So, like I said, we are looking at getting another vendor in for free testing, but we don't know where we're going to put them. So, please give that some thought and ask around to see where would be the most appropriate when that vendor either commits or gives us some kind of yes to coming out here. What in the world we'll do with them. So that's all that I've got on the testing front. Does anybody have any questions with the vaccine or with the testing?
How much does that test cost?
The COVID-19 test, it depends on where you go. If you do it through the health department, it's right at $90. It's a flat fee that it gets charged regardless of insurance because we don't bill insurance. For the mail-off test for Tallulah Clinic, it's based on their income and if they have insurance. So, and then for the urgent care, they have, they bill insurance as well, and I think that they also, their fee for the test varies because if they also run a strep test or a flu test or anything like that, that price keeps going up. So a actual drive up and completely free option we do not have right now. The only free option that we have is our rapid test that we run at the health department, but you have to be symptomatic in order to do that. So, no mail off test right now is completely free. So, it's definitely a needed service, and it's gonna be a big hole, but we also have to figure out what to put up. So, spaces at a premium, so I'm not sure.
Did the school give a reason about what not?
There was some issues, and they were pretty chronic, and so it kind of left a bad taste a little bit. And so, they just weren't interested in revisiting it this time around, which is fine. We just, have to find somewhere else for them to go. And they did have one of their really chronic issues was since they were in a tent, the weather always shut them down. If it was raining too hard or if it was blowing too hard, which this is not an issue now, but if it got too cold, they would always shut down. So having somewhere that has a structure would be handy. I don't even know if that's an option or not, but they're very weather dependent when it comes to testing if they're going to be in any kind of tent or temporary structure. So we hashed it out at the office, and we haven't really come up with a viable solution. So if anybody, health advisory board, health board, general community has any recommendations, that would be great. Because
Contact community churches.
not a bad idea, but no, because it wouldn't run on Sundays. So it's not a terrible option.
A lot of it will depend on what vendor comes and how much space they'll need.
Yeah, so as we get a vendor nailed down, I'll send y'all updates via email, and you can obviously always call me and ask that as well. So any other COVID-19?
Yeah, on the vaccine, you just only do it one day a week.
We do first vaccines on Thursdays and second vaccines on Wednesdays. So we are vaccinating right now on Wednesdays and Thursdays. And then we'll be doing the Johnson & Johnson on Thursdays as well. So the mornings will be one vaccine, whether that's J&J or Moderna, and the afternoon will be the other one. So those will both be on Thursdays, and then the second doses of those Moderna vaccines will be on Wednesdays.
What is the latest for the hours that you vaccine? Just regular normal one?
Just normal hours, we'll do them usually up until 4:15 or 4:30. The biggest thing is after 4:30. We have to monitor for 15 to 30 minutes depending on the person's medical history. And so we try to get them in there by 4:30 in case they have that 30-minute hold that we have to watch them. So up until 4:30 usually.
Okay. Are there any plans or anything having an off-site vaccine?
Well, we do it, Walgreens does it, and Tallulah all do it. And we vaccinate in the Parker Home as well. We had discussions about like homebound individuals or taking the vaccine out of the health department. And that's not an off the table option, but we would need 10 homebound individuals that we would have to go out to because we have to open the vial for that. And we haven't even found that many, because usually if they're homebound and they have transportation issues, when they go to Tallulah Clinic to go to the doctor, they get vaccinated. So, or they'll come and sit in our parking lot and we'll vaccinate them in their car. So, we have put it out there to, like paramedics and stuff, if they know somebody that is truly homebound and cannot come out of the house. We would take basically a list, and when we got 10 people, we could go ahead and draw the vaccine up and administer all 10 doses within a short period of time. But we haven't gotten that many together yet. So, but as far as transportation issues and having to take a whole clinic off-site, we really haven't had that kind of a request. They've been pretty good about if they can't fit our hours, they'll go to Tallulah, and if they can't fit Tallulah hours, like if they want it on a Saturday or a Sunday, Walgreens will actually vaccinate over the whole weekend. So, we've been pretty successful in getting anybody and everybody that wants to be vaccinated around their personal schedule. So. All right, anything else with the vaccine or the testing? All right, environmental health, the annual fee review, that's in the huge stack of papers that you've got in front of you. So, there's one page that looks like this. This is the 2021 comparison count that we do this every year. We'll compare our fees to the counties around us. And as before, we have had our fees well below anyone else around us. So we are recommending a fee increase for our environmental health fees this year, and that is this page. The first page is going to be the on-site wastewater. The second page is wells. The well fees didn't change. The well fees stayed the same. And water lab stayed the same. So the only fees that went up was the actual on-site wastewater. But the water lab and the wells stayed the same. So our increase was just to come up to basically what everybody else is charging. We did separate it out by improvement permit only, construction authorization, and then the full IPCA. So, and that again was to kind of match what everyone else is doing. Cherokee and Macon have started separating theirs out. So we have separated ours out. So, anybody have any questions with these fees? There is one down here at the very bottom, and it said improvement permit without expiration. This was something that Clay County does, and they have had moderate success with it. We actually asked the local realtors what they thought, and they were extremely interested in it. So what this would basically mean is that we would issue a IPCA that would never expire. So no matter how many times they sold the property, this permit would go with them and it would never expire. Now, part of the reason for the high fee is because we would actually have a soil scientist come out and run testing, and we would also have a survey, like an actual survey done of the property. So we would have our own survey plat, we would have our own soil scientist evaluation, and as long as they did not move the lot lines, if they changed the size of the lot, obviously that negates the permit. But as long as the lot stays the same and it does not change, then the permit would stay valid. So this $2,000 would help encompass the cost it would cost us out of pocket to get a survey done and to get a soil scientist out, but it also helps to absorb our loss in fees from people that have to renew. Because we have renewals, we have folks that have renewed 4 and 5 times. That they still have the property, they still haven't done anything with it. After 5 years, the permit expires, and they have to come and re-up the permit. So that's the reason the realtors were really interested in this option, is because these folks that have let their permit lapse will all of a sudden turn up and say, hey, I want to sell my property, and they let the permit expire and have to go back through that whole process again. So this is something, like I said, that Clay County does. No other county in the West does it except for Clay, and so we have brought it up, like I said, to local realtors and a couple of folks that own some lake lots and stuff like that, and they were all extremely interested in it. So we may have some takers on it, we may not, but we wanted to at least offer it as an option. So, anybody have any questions with the fees?
Not sure. It's a lot of fees and a lot.
It's a lot of numbers and it's a lot of fees. So it hasn't, I think we went up $50. We're usually going up about $50 a year till we get to close to what other folks are charging. Like this is the comparison. Cherokee is at $600. We're at $350 right now. We'll be charging $400 as of July 1st. But we were at $350. Clay was at $450. Cherokee's at $600, and Macon's at $500. So if the board approves the fees, it will take us from $350 to $400. So we only went up $50 on each one. So. Any other questions?
Are you, issuing a lot of well permits?
We are issuing a ton of well permits, and we are issuing a ton of on-site. Grant County, or the Western North Carolina in general, by best I can understand, has become a very popular place to live. And there is not many houses for sale out here, so people are buying land instead. So when we get to the fiscal report, you'll see exactly how much more we've made just to now as compared to what I thought we were going to make for this fiscal year. And it's a pretty substantial amount more. So I foresee us still making a pretty, it's not lighting up at all. I've spoken to a couple of lawyers that do closing, and they haven't seen it slack. They don't think it's going to slack. So we'll probably continue on this pretty high road of septics and wells for a while, it sounds like.
Thank you.
You're welcome. And the board will have to approve the fees.
It's been great, guys.
Do what?
I said, it's been great.
You have a motion? I'll make a motion.
Now, second. Okay,
Second.
all in favor?
Aye.
All opposed?
All right, for the annual clinical fee update, that's unchanged. So we'll see if it changes with Medicaid transformation and the Medicaid rates when they change on July 1st. But as of right now, those fees are unchanged. So I will probably come back to you guys in August and I'll let you know whether or not, either August or November, and let you guys know whether or not we're looking at a change there, and we probably will be, but as of right now, there's no change. So, quarterly performance tallies, so let's see, pull up right here. So these are our clinics, this is from last year, so these teal bars right here, this is going to be 2021. Oop, that doesn't look good. So for April, this bar right here, I don't even know if you can see my cursor, not really. This bar right here is for April of 2021. Adult health is actually doing really, really well. Coming into the new year, we were kind of skeptical with COVID, how our clinics were going to rebound, and adult health has done very well. It's doing actually better than it has since I started recording data. So this was January, this bar right here, these teal bars. February was down a little bit, then it spikes in March and spikes again in April. So I'll be real interested to see how adult health keeps on keeping on. I think part of it might be due to people finally returning to their positions, and also Norma Burdette, who is our women's, what do you call it, like wellness person, our provider does really, really well, and I think she probably started drawing us as well. This is our BSET program, which is doing really, really well. We actually got an increase in our numbers in the middle of this fiscal year. So we usually had 21. We actually got an increase to 28 because we had actually expended all of ours by last fall. So they gave us they gave us 5 more for this fiscal year, and then we get 8 more for next fiscal year. So we will be starting the July 2021 fiscal year with 28 instead of 21, which is awesome. So our provider is going to be out for the remainder of this fiscal year. So there won't be any more VSEP reported for May or June, so because she's out of the clinic right now. But starting back in July, those numbers should come back. So the VSEP program has done extremely well this year. We're pretty proud of that. So child health is going pretty steady compared to what we thought it would be, because again, this does not include immunizations anymore. So we're going to see that decrease, and these purple bars are more in line with what it looks like without immunizations mixed in. So we'll see how that continues to play out. Family planning, again, doing really, really well. You can see the teal bars for January, February, March, and April are up, which is awesome. But again, our provider is going to be out for May and June. So this is probably the finality of our 2020-2021 reporting for family planning. But she did really well this year, and they really seem to enjoy her, which I think has drawn in a lot of our numbers as well. So this is our immunization numbers. The reason that you see this big spike in January and then it disappears for February, March, and April is in January we were reporting the COVID numbers in our electronic health record. And then when the numbers got overwhelming, where we were vaccinating 200 or 300 people in a week, we could not keep it up in the EHR. The COVID vaccine actually has its own reporting system, and so we stopped reporting it in our EHR to save time. And so we actually pull all of our COVID numbers from the actual COVID reporting system, which is online with the state. So these numbers are just child health, kids that come in for their shots, adults that come in for a late flu shot, things like that. Tetanus, just routine vaccinations is what you're seeing right here. We will be going and participating in kindergarten registration this week, so we'll see if those numbers go up for May, and they likely will for both us and Tallulah as we vaccinate the kindergartners that are coming in. So this is maternal health, and again, this is just pregnancy tests. So it's kind of, as you can see, over the course of the year, it's just kind of all over the map, because it just depends on how many pregnancy tests we run. But our tele-OB clinic with Harris, I don't think it made it onto the CAT or to the schedule this Sunday. So we'll go ahead and do a little bit of a caveat on that. The tele-OB with Harris Women's is going to be starting the third Wednesday in May. So I'm not sure the date on that, but we are looking at starting our tele-OB services that Wednesday. So we're pretty excited about that. Harris is pretty excited about that. And so we'll keep you updated on how that goes. But it looks like it's going to be the middle of May. This is our STD clinic. And as with most STD clinics, it's kind of all over the map. Just depends on how many people come in to get screened. We will be, with our immunizations and our STD clinic, we will be starting to offer them in the jail. We will be starting with vaccinations in the jail very soon to make sure they're vaccinated, especially targeting the hepatitis A and hepatitis B vaccines while they're still incarcerated. And then moving on to STD screenings as we develop that clinic a little bit more. But the North Carolina, and I believe the nation as a whole, is kind of looking at a hepatitis A epidemic right now. So we really want to try to make sure that everyone is vaccinated for hepatitis A, and if we can catch them when they're incarcerated, that's an excellent time to do it. So, and these are our WIC numbers. Again, most of our WIC at this point is being done over the telephone. They do not physically have to come into the office, and that is waived through August. So these numbers are going to continue to kind of do this and be decreased probably at least through I'd say the end of the year. There are counties that are campaigning to keep it over the phone totally to demonstrate that there is a pretty significant transportation barrier, especially with parents that work. So they're really campaigning to try to get this to move all to telephone and negate the face-to-face in most cases. I'm not sure how that's going to work out. I'll keep the board apprised as that keeps going on. But even though our numbers appear low, according to what the state's reporting, we actually got an increase for this coming fiscal year. So our WIC money actually increased for this coming fiscal year. So, and it's all to do with, obviously, in Graham County, we must have a pretty big transportation barrier, because as soon as they moved it to a telephone call, people started participating again. And they will answer the phone and they will participate as long as it can be over the phone. So we actually did see an increase in WIC participation this year. And I think it also has to do with the pandemic and people losing their jobs and things like that, or maybe their income is not steady. And so we saw an increase with that as well. All right, these are our dental numbers. He has, as you can see, these blue bars, January, he was out part of January, so we've got these teal bars, these three that are spiking right here. These are all 2021. We will probably, and the same thing applies to the hygienist right below it. So here's our hygienist numbers, again, these really high teal bars right here. And the reason for that is they have lost their hygienists in Clay County. So we are the only ones, and Macon County permanently shut down their dental clinic. So we are the only dental clinic in the West really providing Medicaid cleanings and Medicaid dental care. So these numbers will probably continue to spike. Our hygienist right now is booked out until September. So, because there's no one else providing basic Medicaid dental care. I'm not sure if Clay County is any closer to hiring hygienists. I have talked to Clarissa, their interim health director recently, so I'm not sure if that situation has gotten any better for them. But we are looking at the potential of not taking new patients at some point because we can't book her out through the end of the year. And we still have to get in our routine clients. So I have sat down with dental and we've kind of gone back and forth on it. We haven't officially closed it to new patients yet because my conscience won't let me do that, but we also have to be realistic in that, you can only take so many, without either hiring somebody else or cutting it off. So, just to make the board aware, that's what your dental clinic is looking like right now, which is awesome as far as revenues go. It's great, but we've got too many clients, so which is a great problem to have, but it's still a problem. So, our hygienist is booked out until September, and Dr. Frederick's calendar I think is out until July. So, that's kind of what we're looking at right now. Again, it's not a bad problem to have, but it's a problem for the public. So that's what we're looking at with the productivity. Does anybody have any questions this is a lot, I know the graphs are a lot, but it seems like the best way to show trends. So does anybody have any questions with the graphs or the numbers or anything like that?
I have a question about the hygienist. If you had another one, do they have to have a separate workstation, right?
Yes.
Is there another station available there?
There are 3 rooms, but at that point I'd have to sit down with dental on this, because right now we have 2 assistants, a hygienist and a dentist, so each assistant takes either Lisa or Dr. Frederick, and they work together for the day. So I'm not sure, being short a dental assistant, how exactly that would work. But I can tell them it's on the table if we want to look at it. Even on a contract like 1 day a week or something. maybe even Fridays. Because I think Jan's there, yeah, she's there on Fridays, so we may be able to look at cleanings on Fridays. But at that point, it'd have to be somebody that would be willing to work without the dentist being there. So,
I think it's something you should look at until, at least, till somebody knows what Clay County's gonna do.
okay.
Cherokee County, how do they have their own dentist?
Cherokee County does not have a dental clinic. Cherokee County, well, most health departments don't. They can shut theirs down. Cherokee doesn't have one, Swain doesn't have one, I don't think Jackson, in fact, I'm certain Jackson doesn't have one. I don't think Haywood has a dental clinic. So yeah, I think we're really, us and Clay are really the only ones in the west that even do it. So, and I know Buncombe doesn't have one, but they have so many private dentists that will take Medicaid, they don't have an issue with that, with accessibility, but I think we're really the only ones in the west other than Clay, and they don't have a hygienist now, so.
I know personally, this probably, but I've gotten 4 people in the last week with severe dental abscesses that could not get in.
Yeah, that's what we're looking at this point, and it's hard, because I don't want to turn people away, but then our clients, that are our routine clients, can't get in because our schedule is so packed. So,
Well, it sounds like anywhere they serve just people of Gray County, you need somebody else temporarily.
yeah. Yeah, so I'll sit down then with dental, and maybe come back to the board for like a commissioner meeting, you know, and kind of give y'all an update of what we're looking at. They also wanted me to revisit, because their profits are up so much because of the 5% increase, revisit the purchase of the dental chair. It was something we had factored into the 2021 budget, and then COVID happened. So we put capital projects on the back burner, but then obviously, you know, things worked out the way they worked out, and we ended up making more money than we thought we would. So they did want to request a revisit of the dental chair. It was a $20,000 purchase to replace the dental chair that caught fire. So, yeah, so that's not something that I need a decision on tonight, but I probably will come back to the board after you consider that purchase. Becky's not here, so, you know, we can always sit down with Becky on it as well. And I'll talk to her about it, and Jason about it as well, before I come back to the board. But it is something that I wanted to at least bring to your attention, to start considering to replace at least one of the chairs. So, and by chairs, it replaces all of the arms that come off the chair and the light that comes down out of the ceiling. Those all are included in that $20,000 purchase. So, that will be coming up. So. All right, any questions with the productivity? Any other questions? All right, so fiscal, here it is. Communicable disease, we're at 100% because that's all state funds, and we've expended all of our state funds, so we don't make any money off of that one. Child health, we're at 76%, and we've used 92% of the budget. Maternal health, we haven't done as many pregnancy tests, honestly, even though we're almost at 92% of what I expected to make off of this fiscal year. We really haven't spent all that much time in maternal health. So, yeah, we're looking at almost 100% of what I expected to make. Pregnancy care management, this is all state per member per month payment. Year-to-date budget used is only at 7% because this is Loretta, and Loretta is very busy. Loretta is very busy with COVID. So she is not putting the time into care management for a very good reason. And so we're looking with care, the Medicaid transformation, whether or not we're going to even keep this program or if this program is going to go to the private health funds. Because I can't have Loretta doing it. We do have somebody else that's interested in contracting with the health department to do it. But I don't even know if it's worth it or just turn it back to the health plans. So that's something internally we've been discussing for a little while that we're probably gonna have to pull the trigger on pretty soon, is whether or not we're gonna keep this program, because if we do keep the pregnancy care management program, we're probably gonna have to get us a contract nurse to do it with, because Rita just can't do it. There's just literally not enough hours in a day. TB, we're at 28% used, 92%. The 92% is because we're drawing down state funds. Once we draw down all the state funds, that one will be expended. Family planning, we're sitting at 66%, and 83% of the projection has been made, which is really good because, again, that program is winding down because Norma is not going to be with us. So that we'll have some more coming in, but that'll probably start to slow down. Ooh, skip down the page. Okay. Healthy communities. This 105, we had, it showed up on our revenue report. Becky's not here, I was going to ask her about this. We had a donation show up. So I'm not sure, because we basically, this is state funds, and we've drawn all the state funds down for healthy communities. But there was a revenue line for donations. So we're at 105%. Environmental health, 165%. This is what I was referring to with the wells and the septics. We have made, and it's only the beginning of May, 165% of what I predicted that we would make. So I didn't, and if I did, I would by a very small increment. I didn't really change our revenues for this coming fiscal year, because if I changed them by the amount that we've made this year, I'd be taking a pretty big risk, and I'm not really a risky person. So I left them or maybe increased them a little bit, but I'll be interested to see what our housing market does. So yeah, we're sitting at 165% money made off of this fiscal year with septics and wells. HIV and STD. Do what? HIV and STD, we're sitting at 42% spent, 49% made. That's state funds, some revenue. But again, our STD numbers were down for screenings. VSEP and our cervical cancer program, 82%, 57% made. This is all just state funds, and we just got to finish drawing down the state funds for that program. CAP at 175% made. I did go up on these this year because this is a per member per month payment from the state, and the state increased it with COVID. So when I projected last February, that fee increase was not in place, and so I did adjust for that in this coming fiscal year. Dental, they're sitting, even with being closed for part of last fiscal year and still being slow into this coming fiscal year, they still have made 66% of their revenue at $395,000. And we got an increase, our cost settlement for this year is going to be higher than it has been in the last few years. So we will see probably an increase in cost settlement with dental. Care coordination services, this is a program that is also managed, it's very similar to the pregnancy care management program, but this one is with Emily Collins, and she is my preparedness coordinator. So she is obviously extremely busy with COVID this year. So this program, she may be able to manage, unlike Loretta, she may be able to manage this program after COVID slows down a little bit. But with the Medicaid transformation and the 4 companies, you either turn the whole thing back or you keep the whole thing. You can't turn back the children and keep the pregnant women, or vice versa. So if the board has any thoughts as to whether or not you think we should keep both of those programs or we should turn both of those programs back, I'm all ears. So yeah, any thoughts that you have on that would be great. General health, that's all state funds. We've used 75%, we've drawn down 77%. We just draw down a certain percentage of that every single month. So we don't make anything on that, obviously. Immunization action plan, at 101%, we've seen an increase in private vaccine uptake, which is good. But that's the reason we have made over what I originally projected for this year. I was not expecting to see an uptake of vaccine on a private schedule like we have, so I've been very happy with that. But we are at 101% for that. WIC is WIC. It's state funds. You just draw down a certain percentage each month, basically. And then the WIC breastfeeding, we haven't done much with that program, but you can see sitting at 44%, so we haven't drawn down much for that program at 37%. So, food and lodging, this is all state funds. I think we just put in with the state to draw down our $2,500 that we get every year. It'll probably come through at the end of May because we just sent in the invoice for that. So, adult health, we're sitting at 94%, which is really good. We should hit 100% of the revenue without an issue for the rest of this fiscal year. Bioterrorism is totally state funds. We've almost expended all of that. Bioterrorism is basically preparedness. It's called bioterrorism in our logic system, but it's our preparedness funds that help COVID-19 and all that kind of stuff. So, recovery to work and community linkage to care. These are both grant-funded programs. That's the reason you see a lot of blanks out here to the side, because ultimately, I don't know that it's much going to matter as far as the reporting. They can't make any money off this program, and it's a break-even situation. So these are totally grant-funded. COVID-19, I didn't put a projection because Lord knows I just don't have one. We have spent $168,000 on COVID this year, and we have drawn down $171,000 in COVID this year. And that is totally a state-funded drawdown. So as far as expenditures, we're sitting at about 60% of the total budget, but that 60% would probably be looking more like 90% if COVID-19 had a number. So most of that tells you kind of where the staff time has gone, has been primarily into COVID. And then this is the total revenues, which is good because COVID's not in this number. So we're right at about 83% of the expected revenues. So I think that's pretty good. Does anybody have any questions with the financial report?
Just make a comment, I think, about the fees.
Okay.
There's a couple of ways, I guess, you can put fees. We can choose not to charge anything and let the taxpayers of Graham County absorb that burden. But instead, we choose to charge fees for services rendered. I'm going to assume that in most of these property transactions, they're getting well permits, septic permits, etc. We're not being made by people that live in Graham County. They're probably being purchased from people outside of the county. So, from my viewpoint, at least, I don't think I should have to take my personal property tax dollars and help support the cost of their permit for their well that they may choose to sell 2 years from now $1,000 on. So that's just my opinion on things. Either put it on the taxpayer back or the people that are having to use the service pay for it.
Yeah, the other piece to understand about this environmental health at 165%, it's not that our fee isn't high enough to support it, is to consider it a boon on your property values. I mean, the reason it's sitting at 165% isn't because the fee is too high or is adequate, it's because so many applications have come in. And so it's not, that really isn't a reflection so much on the cost of the fee as the sheer volume of permits that have come through the door. So, I mean, that's the reason you're looking at 165%. It's, it's because it's insane, honestly. Some days, I mean, there are days, there's a week we can get 11 or 12 applications in. So it not necessarily actually has absolutely nothing to do with the cost of the fee as much as just the sheer volume of what we've seen come through the door this year has been just astronomical for environmental health. And I don't know how long that's going to sustain. I don't really know. Eventually we're going to run out of usable property. That's kind of been the running joke. Because eventually we're going to run out of things for people to purchase. So I don't know when that time will come, but yeah, I mean, that's what you're looking at when you're looking at that 165%. It's a really good year for the tax values in Grant County and for the for the land sales and property sales and things like that. That's what you're really looking at when you look at environmental health, really in any county, but even just looking at this spreadsheet. So, any questions with the financials? All right, so on to the two programs that I honestly am probably pretty proud of. So the Recovery to Work and the Community Linkage to Care. I didn't know how well these would be able to present this early. Both of these individuals started on January 4th, and neither one of them had any kind of formal training for peer support specialty. So they have worked extremely hard on both of these programs. This is the Recovery to Work program, the pink one. This is the one that is funded through the ARC grant. Bethany has done an extraordinary job with this program. Under the status summary, she'll kind of give you a lowdown on exactly what she's done. So it'll tell you all about the referrals that she's made. She has traveled really all over Western North Carolina with these clients and for these clients, either finding them housing, getting them out of a domestic violence situation, getting them food and clothing. She spends a lot of time at Tallulah, I'm sure. I'm sure they see a lot of Clint and Bethany, which is really good. They're making sure that they get all their medical care. In addition to finding them housing and finding them jobs. So, project overview down here, you'll see the referral sources. Tallulah is one of the big referral sources, and we have appreciated that. It'll tell you the number that she's actively working with, the number that are physically working themselves, and the number that she's housed. So that will kind of give you an idea of how they're doing, how her referrals are doing. She has made 325 contacts to date, and those contacts have been everything from getting in contact with NC Works and probation officers and the sheriff's office and DSS and all kinds of stuff. So, as in the same with her conclusions, as with Clint's, is the major housing issue in Grant County. They're not actually having so much trouble finding them employment as finding them a place to live. So that's really their immediate concern as the peer support specialist, is finding somewhere for these folks to go. Because part of remaining sober is getting out of the current situation that they're in. And so they've tried, they have housed them in Andrews. One lady, she ended up going all the way to Franklin. You know, I mean, they have a pretty extreme reach as far as how far they've gone to try to find these folks somewhere to live. So I'm not sure what that's going to look like in the future as far as if there's anything the county can even do about that. But that seems to be their biggest issue. It's not finding people employment. The employers in Grant County have actually been really great to work with for these folks, and actually some of them have made it some employers have made it a condition of their employment that they work with Bethany and Clint. So that relationship with the employers has built very well, and it's extremely strong. But we've got to find somewhere for them to go. And they have tried to house the ones that, because they have found them employment in other counties in addition to Greene County. So if they found employment outside of Greene County, they've tried to house them outside of Greene County, you know, close to where they were going to be working so they can make it to work. So that's the really big barrier that these two are really fighting against is the housing issues. And they have been able to find like employee housing with either Montana. They're working with the Manhattan Outdoor Center because they have staff housing. You know, so they're trying to kind of work out some other ways. But just finding rentals because they have to put them up with HUD, you know, so they can help make their rent payment, but there's nowhere to rent. So that's the big issues that they're seeing right now. This is Clint's. Clint's is the one that's in blue. These are his referral sources, the number that he's actively working with, the number that are physically employed, and the number that he has housed. So he actually has a pretty robust list right now that exceeds some of these numbers over here on the referral because they're still incarcerated. So he starts working with them while they're still incarcerated. So that way when they get out of jail, he's already built a rapport with them, which has actually worked out very well because he's the first person they call. So when they are released from jail, usually the first phone call they make is to Clint to ask for help. So that has worked out extremely well. That they have actually started reaching out to a sober contact and a clean contact rather than trying to go back to where they came from. So that's went really well. And he also has established the GED program through Tri-County Community College in the jail. That will be a streamed service that will be provided to those incarceration in the Grand County Jail. And they are hoping to get that actually going sometime in the next week. They are also, Tri-County is very supportive of trying to get these clients into college courses if they're interested in continuing past their GED or high school education and getting them some college courses under their belt. So these are some of the contractor or some of the employers that he's been working with. So it's supposed to be Andrews. I missed that. I spelled it, don't get stuff, I missed that. Andrews Trust, Montana Resort, Lovins, NOC, some carpenters and contractors in the area. And both Bethany and Clint have been in contact with Jason over the housing disparity that, you know, and again, like they both said in here, they don't know if there's anything we can do about it, but they wanted to at least bring it to the attention of the board that seems to be the major barrier that they're facing trying to get these people the help that they need. So. But overall, these programs are going extremely well, and I'm very proud of both of these individuals for how far they've taken both of these programs in a pretty short period of time. So. Does anybody have any questions with these two?
The housing is at the very least a regional issue. Every county, I'm on the Foursquare board, and our last meeting, that was one of the hot topics is that, you know, they can't find in the 4-county area, there's literally nothing. People that were renting their homes or taking advantage of the increased tourism and listing their homes with Airbnb and other places, and you know, they're doing in 6 months what they would have done in a year by doing that, or they're selling. My sister's a realtor in Franklin. 2 weeks ago, she told me she had 58 calls in one day. People are buying properties, looking at pictures on the internet, and never coming to see the property and buying it. And that's That's in every county from what I understand, so it's gonna get worse. The best hope, I think, is Dogwood Trust, putting some money into housing, thinking outside the box. I saw a program in, I think in Florida, where they are using, shipping containers and converting them into tiny homes and creating what they call pods of the community. People can have a place to live where they can at least walk to work if they have a job. So I think it's gonna have to be something like that to ever get any relief whatsoever from.
Yeah, and the other issue is just like with our environmental health report, people are buying up the land. You know, that doesn't even have a house on it yet. I don't even know if they have any intention of building on it, but just like you said, sight unseen, those are private property. So it's disappearing very, very, very quickly. What is available is going very fast. The 2020 State of the County Health Report, that is the scorecard. So let's see, I think this is one. Yep. This is the 2020 Graham County State of the County Health Report scorecard. This will be the third year of our child cycle. So next year will be a full community health assessment again. So out to the side, this is where you really see these kind of up and down arrows, because these numbers aren't going to make a whole lot of sense. So the green arrows is a good sign, the black is neutral, and the red is not a good sign. So the percentage of adults with reporting more than 7 days of mental health, poor mental health, has gone up. You've seen a baseline change of 45%. And then the Strengthening Families program, that started and then COVID happened and it obviously stopped. So I would love to see this program get back off the ground. I don't know if that's going to be a possibility because that program was actually a collaboration with Swain County. So I'm not sure if Swain County is even looking at this program still or if they've kind of scrapped it. So that's going to have to be something that we revisit later. Mental health first aid. Again, COVID shut down pretty much all of those trainings, as it did with the ACS trainings in schools, or ACES training. The peer support program, this was reported at the beginning of the year. We now have 2, and then obviously the number of participants that they have. So these numbers just aren't reported because we didn't this report too soon. So. Substance abuse, these numbers are pulled from the state. So, number of unintentional poisoning deaths due to medication or overdose is sitting steady. But the only problem with this is a lot of times what happens is this gets suppressed because our numbers aren't high enough. But we all know of at least a few individuals, either personally or by hearsay, that have died of overdoses this year. So that number, the issue is it gets suppressed because we don't have enough deaths. So adult binge drinking in the past month, that report went down. The number of injury poisoning deaths, we had looks like 1. So you saw a 50% increase. So that's the problem with these numbers, is it's going to look skewed no matter how you look at it because our numbers are so low. But the biggest thing is the trends, which way these arrows are going, as to whether or not it's good or it's bad. So heart disease, adult obesity, which we know are big issues out this way, not just in Graham County, but just in general. Taking action to control the high blood pressure, looks like it's going in the right direction, which is awesome. The wellness fair we are going to do again this year. I'm pretty excited about it. We are going to do Halloween again this year. So this health and wellness fair, we will be doing that this year. So we're pretty excited about that. The Wise and Well program, the workplace wellness program for the county never started this fiscal year. I'm not sure, Jason, if you want to revisit that program or not. But that would probably be a big question. So just touch base with her on whether or not in this coming 21-22 fiscal year, if that's something we want to revisit and restart the workplace wellness program or just let it go. So just let us know either way. New and emerging issues, we didn't really have any as far as chronic disease. It's all been around COVID, which is just a, acute illness kind of thing. So it's not going to go on our emerging issues for community health as a whole. So we didn't have any emerging issues. So, the biggest thing with this one is pretty much to follow the trend of the arrows. And like I said, we'll have a full community health assessment coming out for 2021 and 2022. So, any questions with the scorecard? All right, and now we're going to turn it over to Loretta for the CFPT and communicable disease.
The child fatality prevention team, we have not met in more than a year because of COVID. I feel like that's our response to everything anymore because of COVID, but we're moving on now. We will have our first face-to-face meeting in June. Happy to report that we have no child deaths to review. Our meetings, when we are not reviewing child deaths, are focusing on child safety. And our team consists of members from the Sheriff's Department, the school system, medical providers, family members that have lost children. So we try to reach a broad group of people in the community, do outreach and education. So we're actually looking forward to get together with that team. Social services is also involved. So we'll keep you updated. I'm going to complete the state survey for our team that's due annually. That'll be completed this week. Our communicable disease update, I will give you an annual report at our August meeting. And we have been following up on communicable diseases other than COVID. It's been a very, very busy year. Nursing staff are now getting time to do our trainings that we do annually related to various communicable diseases and follow-up, contact tracing. So we're looking forward to getting back into whatever our new normal is right now.
All right, anybody have any questions for Loretta, whether they be COVID or communicable disease related? All right, I've just done a little bit of legislative updates. I've been trying to send you guys those bills. I don't know if you can read them, but the bills that are coming through the House and through the Senate that are related to public health. The big one that's coming down the pipe right now is the appropriations for communicable disease. We typically only get, what did I say? Which one was this one? For communicable disease, right now we only get $11,000 a year to do communicable disease in Grant County. So, not nearly enough. So, there is a pretty big push in light of COVID, because the issue with COVID funds, don't get me wrong, all 171,000 of them have been great. But the problem with them is they're one-time funds. So monitoring communicable disease won't stop when COVID is done. So the appropriations for the Senate budget has a pretty big package in it for continuous communicable disease funding for health departments. So I did get a draft, which I can send to the board. I got a draft of a letter of support for that funding to send to Senator Corbett. I will send you guys, it's just a generic to read over. And part of the reason I would like for you to read over it is because it comes from me, but it says with the support of the Graham County Board of Health. So I want you to please review it. I'll email it to all of you, and as long as you support me sending it, I will send it. If you don't want me to send it, I will. So just look over it. It's pretty generic as far as it just says that we support the communicable disease funding for the health departments. And it went out to every health department in the state. So I'll forward that on to you guys, but I wanted to give you a heads up that it will be showing up in your mailbox. And that is just to support the recurring communicable disease funding for the health department. So that's all I've got for the legislative update, unless anybody has any questions about everything that we have covered this evening.
I have a question about something we haven't covered.
Oh, Lord. Let's have it.
Medicaid transformation, what's going to be the impact at the health department? I heard from the transit director last week, and it sounds like it's just going to be a train wreck for them.
I love this, just nod, you're right. It actually, well, it's going to be a train wreck, but it's not going to be a tremendous train wreck to us.
Yeah.
So nice deep breath.
We're on a small train.
we're sitting on the side of the tracks. We'll see what we get hit with. The reason I say that is because dental is carved out. And family planning is carved out, which is where we make most of our revenues. So now what cost settlement will look like after Medicaid transformation, I cannot say, which is the reason we'll get hit with the debris. It won't change how much we get paid because it stays in the fee for service model for family planning and dental. Our other big program is VSEP, but that is for uninsured individuals. So they aren't impacted by the Medicaid transformation either. Where we would have taken a huge hit, which is the reason a couple of years ago I handed it over to Tallulah Clinic, was child health. So that's where we were going to take our big hit. So I went ahead and carved it out of my budget because we were going to take a pretty significant chopping on that one. So really where the only place we're going to see an impact is in our cost settlement. With those two programs being carved out, I'm hoping that cost settlement will stay, but we're not guaranteed that. We know that cost settlement will no longer apply to those programs that did go under Medicaid transformation. So if we had kept child health, we would not get cost settlement for child health. But I'm hoping that since dental and family planning are both carved out and those are both our money makers, we will still get our cost settlement. But the state has in no way guaranteed me that. But I do know that our revenue lines and projections and all that will actually stay the same because those two programs will stay in the fee-for-service model today. What that does next time around, which I don't know that dental would ever fall under it simply because the state doesn't know what to do with dental, honestly. So I don't know that dental would ever change. And family planning it's called family planning Medicaid. It's not even regular Medicaid. So I don't know that they would ever do anything with that program either. So we're more sideline travel.
We are, the clinical staff, and the nurses, we're participating in all of the plan's webinars because it is going to have a huge impact on our county. And it's going to have a huge, huge impact on our private providers, primary care providers. And part of what we do at the health department with clinical staff is we navigate our patients through the process of getting hooked up with a primary care provider. So we need to, as nursing staff, know enough about each individual plan to help that client be able to navigate because it is extremely complicated, isn't it, Jill? When you start looking, different plans have different expectations.
Like what our training is for example, my diabetics, I'm finding that they're picking a plan because it says that their diabetic medications are covered, and 1 month later, they send them a notice and say they're not covered. After they pick the plan and are now entrenched in the plan. And so there's a lot of that going on, but behind the scenes, it's not fair to the clients that are doing the picking, but thank goodness we have a federally funded clinic in the county, thank you very much, and we're able to get millions of dollars worth of medications for free through the companies and through our eye care program. We're doing a lot of work with paying the co-pays on a lot of people that are in the donut hole, and it's making a huge impact in the actual, food income for patients, so that they can actually eat and pay their rent or their housing. I think that our senior citizens are very hard hit. If you look at even how Medicare plans come down, the cost of medicine changes literally refill to refill for some of those patients to the tune of free or $400. It's ridiculous, and to be able to give them the highest quality medication for the price is a big deal. We're working hard, but it's not easy, especially with these changes.
Not health department related, to one of the scenarios in the transit was that you have a client, had a doctor in Silver, and that doctor wanted to go see a different doctor in Silver on the same trip, and they could not transport that client over there without picking up the phone and calling somebody to get approval for the additional mileage. And that had to happen within 15 minutes to get a live person on the phone before they could transport and be able to do on Medicare for the transport.
That's ridiculous.
And it was worse beyond that. I've never heard such a story in my life about trying to provide services. Unbelievable. Unbelievable.
Well, between our case management right now and our peer support, I'm just astounded at how much service we can offer. It's pretty incredible, and that's because we're effective. That's the only way we're doing it.
I think in the grant for that, we only projected doing 3 people initially, so.
Yeah, they've done Clint and Bethany work really, really well together, which is awesome, and they have done a great job of sharing the funds as far as there are certain things that Bethany can purchase that weren't written into the CLC grant, or there's things in the CLC grant that weren't written into the Recovery to Work grant, and so like they've been able to get, and they wrote them on the list, but it's phone cards, cell phones, like rent payments, like, when you first rent, it's like first month, last month, and the security deposit. Most people, when they either come out of jail or are trying to find somewhere to live, they don't have that kind of money. So there's actually money for that, to help them pay a down payment for their power bill, that security deposit for whatever, So, but the biggest thing that they've spent most of it on have been phones. Because if the person has no way to call a doctor or to set up their doctor's appointments or to call their employer or whatever, you're already starting behind the 8 ball. So phones has been one of their big things, and phone cards. And the other big one was they have done a tremendous amount towards getting people their driver's license back, which costs a lot because they have all those fees, or whatever reason they lost their license to begin with. And legal aid, which also is a big thing for them. They've hooked up a lot of clients with the legal aid and getting Social Security cards, birth certificates, all that kind of stuff. They just didn't know how to access or just couldn't figure it out because COVID shut down the Social Security office, so you can't walk in anymore. So they've done a lot towards helping them navigate that code system and trying to get a new copy of their Social Security card. So, yeah, they've done some pretty awesome work. I'm pretty proud of them. Any other questions or? New business, old business? I don't have anything.
Jake, you still on?
You got disconnected.
I'll wait.
Okay, you're there.
You got any your own business?
I'll wait.
Okay. Do we have anything to close?
I don't have anything to close.
Do we have a motion to adjourn?
I would make that motion.
I'll say.
All in favor?